Today, we will talk about the top 10 highest paid jobs. Healthcare jobs top the list of the highest paid jobs, and the sector's future is bright. According to the U.S. Bureau of Labor Statistics, BLS, employment in healthcare occupations is projected to grow 13% from 2023 to 2031. This should add about 2 million new jobs. This growth is due to the need to replace workers who leave their occupations permanently, according to the agency. For comparison, the BLS projects overall job growth in the U.S. of 5.3% between 2023 and 2031. The top 10 highest paid jobs here are 1. Cardiologist, $353,970. Cardiologists are surgeons who diagnose, treat, manage, and prevent diseases or conditions of the cardiovascular system, according to the BLS. Some specialize in procedures designed to intervene in heart conditions, including balloon angioplasty and stent placement. Others center their work around echocardiography, the use of electrodes to examine and treat the chambers of the heart, or electrophysiology, which involves the heart's electrical system. Cardiologists are often scheduled to work during normal business hours, but that can turn into a 50 to 60-hour work week based on patient load and the heart-related events over which they have no control. Even with regular scheduling, somebody has to be available or on duty for evenings, weekends, and holidays. 2. Anesthesiologist, $331,190. The BLS defines anesthesiologists as physicians who administer anesthetics and analgesics for pain management prior to, during, or after surgery. This highly specialized career is second on the list of highest earning professions. Work hours for an anesthesiologist can be long and unpredictable since they follow the schedule of the operating room. Anesthesiologists need to be there for both scheduled surgeries and emergency procedures, adding to the unpredictable nature of the workday. 3. Oral and maxillofacial surgeon, $311,460. Oral and maxillofacial surgeons treat a wide range of diseases, injuries, and defects in and around the mouth and jaw. Among the more common problems they're likely to manage are wisdom teeth, misaligned jaws, and tumors and cysts of the jaw and mouth. They may also perform dental implant surgery. Oral and maxillofacial surgeons work for hospitals, large medical centers, and dental practices. They may be professors at dental schools or supervisors of residents in training. Many oral and maxillofacial surgeons open their own practices. They work very long hours performing intricate and complex surgeries. Oral surgeons may also need to be on call for emergencies that require immediate treatment. 4. Emergency medicine physician, $310,640. As the title implies, emergency medicine physicians must make on-the-spot medical decisions to prevent death or serious injury. They have to act immediately to evaluate, stabilize, and care for patients who have often suffered trauma. They may supervise emergency medical staff in an emergency department. Here, physicians are often called to work irregular or long hours to care for patients, especially in an emergency situation. They may work overnight or weekends to care for a constantly shifting patient load. 5. Orthopedic surgeon, except pediatric, $306,220. Orthopedic surgeons diagnose and perform surgery to treat and prevent rheumatic and other diseases in the musculoskeletal system, according to the BLS. Most orthopedic surgeons work in a hospital setting or in private clinics. This can involve both scheduled and emergency surgery, resulting in a sometimes hectic schedule and long hours. For example, back or neck surgeries can sometimes take an entire day without breaks. 6. Dermatologist, $302,740. Dermatologists diagnose and treat diseases relating to the skin, hair, and nails. They may perform both medical and dermatological surgery functions. Dermatologists can either work in private practice or attend clinics at major teaching hospitals and institutions. Dermatologists rarely work unscheduled or erratic hours. The majority work a set schedule and have normal work hours of between 30 to 40 hours a week. 7. Radiologist, $301,720. A radiologist is a physician who diagnoses and treats diseases and injuries using medical imaging techniques such as X-rays, magnetic resonance imaging, MRI, nuclear medicine, and ultrasound. They may perform minimally invasive medical procedures. Most of a radiologist's work is done in an office setting and involves interpreting images, reading reports, and going over the results and diagnosis with other physicians. Most communication is done through a patient's physician, who is responsible for applying the results and making treatment decisions. 8. Surgeon, Other, $297,800. A surgeon is responsible for operating on patients with injuries or illnesses. Duties include reviewing patient X-rays and communicating with the patient about the procedure, preparing for surgery, and completing surgeries with the assistance of other surgeons, nurses, and surgical technicians. On average, a general surgeon works 50 to 60 hours per week, not including time available for on-call duty. Depending on the practice, surgeons can be on call nearly 24 hours a day, 7 days a week. 9. Obstetrician gynecologist, $296,210. Doctors who specialize in vaginal, ovarian, uterine, and cervical reproductive health and childbirth are known as obstetricians gynecologists or OB-GYNs. This is a medical specialty that focuses on providing medical care related to pregnancy or childbirth. OB-GYNs also diagnose, treat, and help prevent diseases of people with female reproductive systems, particularly those affecting that system. While the work schedule usually involves seeing patients on a regularly scheduled basis, attending to a patient giving birth to a child can occur at any time of the day or night and requires being on call for these events throughout a career. 10. Pediatric surgeon, $290,310. Pediatric surgeons diagnose and perform surgery to treat fetal abnormalities and birth defects, diseases, and injuries in fetuses, premature and newborn infants, children, and adolescents. This can include many pediatric surgical specialties and subspecialties. In most cases, pediatric surgeons get jobs at children's hospitals, community hospitals, or university medical centers. They work with a team of, what do you think of our video? Let me know in the comment section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.